I will tell you the top 7 signs of kidney toxicity, which means that the kidneys are not working properly. You may already know some late signs such as leg swelling, severe itching of the body, or decreased urination. But the problem is that most of these symptoms appear very late. In many cases, they appear when kidney function is already severely damaged, sometimes when up to 90% of kidney function is already lost. And once kidney tissue is damaged, it usually does not recover well because the kidneys have limited regenerative ability. The kidneys have very powerful compensatory mechanisms. That is why kidney damage can progress silently for many years without obvious symptoms. So instead of focusing on late symptoms that already indicate advanced kidney disease or even kidney failure, the kidneys are the most powerful blood filtration system in the body. Every day, they filter almost 200 liters of blood and produce around 2 liters of urine. Their job is to remove substances that are present in excess in the blood, such as sodium, glucose, urea, and many metabolic waste products. In addition, the kidneys regulate blood pressure and help prevent anemia by producing erythropoietin, a hormone that stimulates the bone marrow to produce red blood cells. Kidney disease is much more common than most people think. About 1 in 10 adults has some form of kidney disease, and many of them do not know about it because early kidney damage usually causes no obvious symptoms. One of the earliest signs of kidney damage is slightly elevated blood pressure. When the tiny blood vessels in the kidneys become damaged, the kidneys interpret this as reduced blood flow. They respond by activating hormonal systems that raise blood pressure in order to restore blood flow to the kidneys. That is why years before kidney disease is diagnosed, sometimes even 10 years earlier, a person may develop mildly elevated blood pressure around 130 to 145. This can occur because of chronic high blood glucose, obesity, smoking, or chronic inflammation, which damage the endothelial lining of blood vessels and reduce nitric oxide, leading to vessel stiffness and narrowing. One practical thing to do if you are concerned about kidney health is to check the urine albumin test, also known as the Microalbuminuria test. Albumin is a large protein that normally remains in the bloodstream and should not appear in urine. But when the kidneys are even slightly damaged, small amounts of albumin begin to leak into the urine. This leakage often appears long before kidney filtration declines. If microalbuminuria is present, it often indicates that progressive kidney damage has already started. Another early sign is frequent nighttime urination. If a person wakes up regularly 1 or 2 times every night to urinate, this may be clinically significant. Normally during sleep, the body releases more vasopressin, also called antidiuretic hormone, which reduces urine production by about 70% during the night. But when kidney damage begins, the renal tubules that reabsorb water may become impaired. The kidneys filter blood normally, but cannot reabsorb enough water back into the circulation, so more urine is produced during the night. This condition is called impaired urine concentration, and it can appear even when blood tests such as creatinine and glomerular filtration rates still look normal. Another sign is salt sensitivity. In healthy kidneys, excess sodium from food is eliminated through urine within about 24 hours. But when early kidney dysfunction develops, sodium is not excreted efficiently and begins to accumulate in the body. This leads to salt-sensitive hypertension. About 50% of people with hypertension have this type of blood pressure response. Many of them notice that their blood pressure increases after salty foods such as pickles, chips, or processed meat. They may also notice that their face looks puffy the next morning, or their fingers and rings feel tight because of mild fluid retention. Puffy eyes in the morning are another possible sign. The tissue around the eyelids is very thin and loose, so even small fluid shifts become visible there. In many people, morning puffiness is normal and occurs because fluid redistributes toward the face during sleep, especially after alcohol, poor sleep, crying, allergies, or a high-salt meal. Usually it disappears within a few hours after waking. But when kidney function declines, proteins such as albumin can leak into the urine. When albumin levels in the blood decrease, the oncotic pressure that keeps fluid inside blood vessels also decreases. Fluid then moves into tissues, and one of the first places this becomes visible is around the eyes. If puffiness persists or appears together with swelling in the legs, foamy urine, or elevated blood pressure, kidney problems should be considered. Another early indicator of kidney stress is a gradual increase in blood creatinine levels, even when the value is still within the laboratory reference range. Creatinine is produced during normal muscle metabolism and should be removed from the body through urine. In many men, the typical reference range is about 0.7 to 1.3 milligrams per deciliter. But the important factor is not only the absolute value but also the trend over time. If creatinine gradually increases from 0.8% to 1% and later to 1.1% over several years, this may suggest that kidney filtration is slowly declining. Metabolic changes can also appear early. One example is slightly elevated triglycerides. The kidneys participate in lipoprotein metabolism, including the breakdown of very low-density lipoproteins. When kidney function begins to decline, the activity of the enzyme lipoprotein lipase decreases, which reduces triglyceride breakdown. As a result, triglycerides may gradually increase in the blood many years before kidney disease becomes clinically obvious. Another important sign is persistent foamy urine. Normally, the kidneys prevent proteins from passing into the urine, but when the filtration barrier becomes damaged, proteins leak into the urine and create stable foam. This foam often resembles beer foam and can remain visible for several minutes. Temporary bubbles that disappear quickly are usually harmless and can occur because of fast urination, concentrated urine, residual soap in the toilet, intense exercise, or semen proteins after ejaculation. Foamy urine becomes more concerning when it is persistent or appears together with swelling, high blood pressure, fatigue, or abnormal urine tests. The most practical way to protect the kidneys is to control the factors that slowly damage them. Keeping blood pressure below 130 is extremely important because chronic hypertension directly injures the small vessels of the kidneys. Checking urine for microalbumin once per year helps detect early protein leakage. Reducing sodium intake lowers blood pressure and fluid retention. Maintaining normal blood glucose protects the tiny kidney capillaries from glucose toxicity. Maintaining healthy body weight prevents glomerular hyperfiltration, which forces the kidneys to work excessively. Long-term use of non-steroidal anti-inflammatory drugs such as ibuprofen and diclofenac should be avoided because they reduce prostaglandins that maintain kidney blood flow. Staying well hydrated without excessive water intake supports kidney filtration. Stopping smoking improves blood vessel health and kidney perfusion. Limiting ultra-processed foods reduces sodium and harmful additives. And controlling cholesterol and alcohol intake improves vascular health. Increasing fruits and vegetables helps maintain metabolic balance and reduces the acidity of urine, which supports overall kidney function for the long term.